Hello friends, in this video we are talking about the parametrial involvement of the endometriosis. You can see the dissection is going to start with the virgin area, that is the sacrum, or maybe at the IP ligament. You can see we are using the only two instruments, that is a bipolar shearer and a bipolar itself. You can see one thing we need to understand, we have to be a parallel to the tubular structures. Once we are parallel to the tubular structures, usually blood loss will not be there. We are in a proper plane. Here the ureter is already been dissected and now we are dissecting the pararectal space. Saying so, when we had started doing a dissection of the pararectal space, the uterosacral in this patient was involved. So once the ureter is being lateralized, what remains parallel to the ureter is the uterosacral and the pararectal space. Here the nick by nick dissection is been done in order to have a separation of the ureter. The ureter is involved in the this particular parametrium, and the it is usually the disease which going to affect by the endometriosis. You can see we are just doing the blind dissections between the two fold of the periureteric sheath. You can observe here the periureteral sheath is adherent to the ureter, and so this blunt dissections helps a lot. You can see the ureter is now lateralized and we are just giving the strokes parallel to the ureter, and the ureteric sheath is been dissected. You can see the plastering of the peritoneum and the parametrium to the tissue. We are going to dissect the into the pararectal space is already been dissected. You can see the below of the bipolar where the pararectal space is already been dissected out, and in this patient there was the adhesion at the rectum. So already the rectal dissection is been done and we are going to dissect out the lateral spaces of the ureter. Herein, we are going to dissect a peritoneum which is already been affected. The peritoneum is already been dissected, and the dissection is going now into the periureteric tunnel, and the ureteric tunnel will be going to show in a little while. It is the parallel stroke of the instrument which will be helpful, and now you can see we are cutting the ureteric sheath, but in order to have the proper traction we are going to delineate it, because once the delineation of the ureter is been done with the parallel strokes, then it is going to be helpful for us to identify the ureter into that puckering area. You can see this particular where the broad ligament or the parametrium, which is going to be a thick structures, and here the ureteric tunnel dissection is already been done. You can see the ureter is going from the ureteric tunnel and it is safeguarded. Herein, our instrument are just a simple instrument. We are using a bipolar shearer and the bipolar for the traction. The traction and counter traction plays the important role. The ureter is safeguarded, and you can observe the ureteric tunnel dissection is been done. This is the parametrial nodule, and the parametrial nodule of the endometriosis. We are dissecting it out from the uterosacrals. You can see the uterosacral ligaments is also very much thick, and we are going to dissect out the uterosacral ligaments. And here you can see the whenever I am giving the cut with the bipolar shearer, the usually this is a very thick and tough structure. You can see the toughness of the structure by giving the pull, and it is just adherent to each other. The ureter in your vision, you can start dissection down. Now the normal tissue comes up, and once the normal tissue is been observed, we are just going to do a dissection of the already pararectal spaces are being dissected down. This is the uterosacral. Now after the parametrial nodule, we are going to dissect out the affected uterosacral ligaments, and this is the uterosacral ligaments where we are taking it up with the bipolar shearer, and the dissection proceeds further. Once the dissection is in a proper plane, usually when you are in a normal plane, the cutting mode of the shearer will be easier. You can see the uterosacral which is thicker and going to affected by the endometriotic lesions, and you can see the when I am cutting it down, there is a brownish structures which is coming out, and this is because of the endometriosis. This particular uterosacral ligaments are going to get dissected. We are just below the uterosacral ligaments, so we are taking utmost precautions that it is not going to affect our nerves which is lying below or medial to the uterosacral ligaments. And once this dissection is been done, this is the dissection on the other side of the uterosacral ligaments. Already the pararectal nodule of this on the left side is already been dissected out. You can see the pararectal dissection is already been carried out, and this is the uterosacral ligaments where we are dissecting. Once the uterosacral ligaments are taken care of, what is remain is the just to have the pouch of Douglas has to be freed from the both the sides. Here the you can observe, if we are in a proper plane, the dissection goes very well. On the right side of the patient, the uterosacral and everything is been done. This is the posterior fornix of where an assistant finger is there, and now the dissection is been cleared off from the rectum. You can see the rectum which is very much below down, and this is the finger in the pouch of Douglas or the posterior fornix of the patient, and the uterosacral is been taken care of. On the right side and the left side, the pararectal nodule is already been dissected. Unfortunately, we not had the videos at that particular frame of time, and you can see the bilateral ureters are very much there and intact. These are the final views of the both the sides, wherein you can see there is a peritoneum on the right side which has been there. We are going to take care of this of the peritoneum of the broad ligaments on the right side, and the dissection proceeds out. This is usually the bleeding vessels from the minute bleeder from the pararectal area which can be cauterized, and this is the final view. Thank you.